Hello, everyone. Welcome to the Influential Women Podcast. I have the honor of having Miss Sarah Joseph here with us today. Welcome, Sarah.
Thank you, Jenny.
How are you?
I'm well.
And look, we both got the memo to wear pink. If you're listening, we'll just vision us in two cute pink dresses because we're matchy-match, right?
Yes.
So tell me a little bit about yourself and what you do.
I am currently working as the Public Information Officer at the Pueblo Department of Public Health and Environment.
Oh,
I've been at the health department for 22 years.
22 years already? Oh my gosh.
Yes. I
That's
think
gone
I'm
fast.
only 17 years old on the inside,
Good for you.
but I get the annual acknowledgement of how many years I've been at the health department, and I'm currently at 22.
Oh, and you've had, that's a big position at the health department. I respect you and all the things that you do for our community, but I cannot imagine being in your shoes in, this last pandemic, this last year of COVID that we've had. How did you handle that?
You keep going.
You
just keep going. And it's definitely with the help of many people. Mm-hmm. Many people. There are great communicators in this community. And fortunately, public health has planned for pandemics. It's our job to be prepared. And knock on wood, we never thought it would ever happen, especially in our lifetime. Mm-hmm. But back in the 2004 to 2006, we were planning. And short after that, H1N1 came, which was a strain of flu, and it became a pandemic. Mm-hmm. And during
the swine flu, right?
Yes, the swine flu. Fortunately, there was a vaccine, and we had vaccinations at high schools and got a lot of people vaccinated at one time. But during that time, I recognized the need to create a communications group where communicators can get together and know each other's cell phone numbers. So when we call upon each other, the phone number comes up and we recognize it. Mm-hmm. We don't push it away. Who's this that keeps calling me?
Right.
And also at that time, there was an explosion downtown at the Branch Inn.
I remember that.
And the poor fire department, they were the first responders on scene. And because there was asbestos in the building, they had to fence off downtown. And that made national news. And the public information officer, Woody, was getting hounded with phone calls, national phone calls. He had over 300 messages he had to respond to.
Oh, my gosh.
And the other communicating responders of public health, police, Border Waterworks, we wanted to help, but we didn't have those relationships built already. And the folks in charge, who would be the directors of the organizations, there wasn't the trust or anything built up. So that was something where we said, Woody, we wanted to help you, but we couldn't get to you. We could have wrote the press releases. We could have monitored the media. We could have answered the phone for you, and then you could have given us your agency's standpoint to respond and statements. Mm-hmm. So from that, I created the Risk Communication Network, which has been around for over 10 years, and it's a group of communicators from utilities to the university to the community college, and we meet quarterly, and we do trainings and also just build camaraderie.
That's
so we know
awesome.
each other.
And so it was not easy, but like you had the tools that you needed to be able to move forward quickly.
Yes, and what was nice was back in February, a year ago, mm-hmm. the group members were calling me, Sarah, what's going on? They knew public health was the lead on this, and they said, and so I put out an email, a friendly email. I didn't realize how quick it was coming in. Mm-hmm. And I said, maybe we can get together in March. And they all responded, let's get together tomorrow.
Ooh.
And
so it happened quick.
It was quick. And I laugh thinking back because we got together at the health department in a small room. All of us at the table, huddled together, signing in with the same pencil or pen, passing it around. Where a month later, you wouldn't dare sit next to somebody within 6 feet or touch what they were touching without sanitizing.
Right, man, things have changed since that February date.
They did. And that group, we met every Monday, and we still are meeting.
Okay.
We've now gone to every other Monday. But we're able to share information and keep a unified message throughout our community. So we build a solid communication throughout the community. And it's really that group and then the great team that within the health department, working with the emergency services of the sheriff's department, we had a joint information center that we activated, which was one phone number that all calls went into. And we had 30 people rotating, filling shifts where we had to space them out. So we could only do between 6 and 9 people answering the phone at one time. But people could get an answer with factual information to make the right decision for themselves at the right time.
Absolutely. And so what was your biggest obstacle that you overcame throughout the last year?
My biggest obstacle was working with different personalities and strong personalities and learning my role and my reaction and communication with them for the greater good.
For the greater good. And do you think sometimes we kind of just react, or, we're used to being a certain way, but for the better good? I love how you said that. You had to change yourself a little bit to be able to advance, our community.
Yes. And you're working with strong people who come with strong personalities, and they have a way of communicating and getting their job done. And you're not going to change them, but you work with them and learn how to get to what you're both trying to accomplish. Everybody was really working for the health of our community or the health of the world at that time, and we still are. And I had to learn different skills on how to work with them.
Gotcha. Well, I love that you just adapted. Like you realize that you're not going to change them. So how can I adapt to make this work? Because we do have the same goals. So I respect that about you. And during all this, did you ever get COVID?
No.
You never got it?
Not to my knowledge. I never had symptoms of any sort. I don't think I was asymptomatic. My husband was pretty much a lockdown with our family.
Gotcha. So did you have to quarantine, or being that you were that person like making all these decisions, you were there?
I wore a mask as soon as I got home. In my household, we had to take off our shoes and wash our hands before we entered into the house. We really kept I didn't see my family. Family would invite us over, and I did see my parents, but we would sit outside on the porch with our masks on. So I just limited who I was with. And Jenny, literally, I worked so much. I didn't get to go see people. So there wasn't time to be exposed to it very much. If people brought it into the Emergency Operations Center, because I left the health department for a year and worked across the street at the Sheriff's Department in the Emergency Operations Center, which is a very big room, and they limited it, and we had the COVID check going in. And I believe later in the year, people had gotten it, but I was never exposed.
Gotcha.
When they did the contact tracing.
And a year later, how are we doing? Like, where are we at? I mean, what's going well? What do we still need to do better?
Sure. Gatherings is where it's spreading, and that can be in work or now it's graduation party time.
Oh, yep.
Weddings are coming up. We'll often see spread due to that. People are getting together. They get close. If it's not outdoors, even if it's outdoors, if they're close and it's large groups of people, that's where we're seeing spread. But the one thing we can do is vaccinate.
And where are our numbers with vaccination?
Sure. Our vaccinations, we're over 65,000 people have been vaccinated, and we're about 67% of our population. And this is late May when we're talking. So hopefully we'll be over 50% in June, but our goal is 70 plus.
70
plus % of our population, then we should have protection more or less in the community. And
you've made it so easy. Like when I went to get my first shot, like I drove in, they filled out the thing for me. Like I didn't even have to do it. Just got on my phone. They scanned it. They gave me a shot, and then you wait 15 minutes to make sure you don't have a reaction. Like it was so easy. There was no line.
Yes.
Wow. Like I was completely impressed how easy it was to go get it done.
It's great. We have really good team members. FEMA, we're fortunate. We're the only community in the state of Colorado where FEMA has come in to help. And like you said, they made it easy. Every week we would meet with them when they first came in, and they'd say, how can we remove barriers? What can we do to remove barriers? And first, a barrier was you had to sign up online. Mm-hmm. You had to make an appointment.
Right. And you probably found like the elderly that didn't have smartphones, like they needed it, more than anybody at the beginning, and then they couldn't even do it. So now they do it for, it's easy
Drive
peasy.
up, walk up. I tell people, take a horse up. Any way you can get there.
Yeah.
And there's a bus riding downtown that would take people there. So if transportation is an issue, if you can get to the main bus station downtown, you can get there. Mm-hmm. And no appointment needed. You can make an appointment if that helps you. But like you said, you just drive up and go through.
Absolutely. And everybody has their own reason on why to get it or why not.
Yes.
Why should, if we're at 75%, are our schools and our lives going to be back to normal?
Yes, it helps us go back to opening things up. And, I never thought I would. A concert. Mm-hmm. Going to a concert, singing out loud, people bumping into me. Mm-hmm. When will we have that again? Not sure. I'm not sure when that'll happen. But I think we're definitely on the path to get there.
We're on the
path.
The
more people that get vaccinated, the more we can open things. So the concern right now is the load on our hospital. Uh-huh. And that's currently still up.
Is it still high at Parkview?
Yes, there's only so many beds for that intensive care that can be made. And when they reach that higher part, then they can't take on other people and they have to divert them to other hospitals. So you'll have to travel to Springs or Denver, say you have a heart attack or a stroke or you're in a car accident. They can't help you because they're already full with COVID patients. So they're high. They're not maxed right now, but they're at the 80 to 90%, and
that's still pretty high.
Every week or so, they do max, come down. They do max, but we want to be under 10. Mm-hmm. And our goal in public health is to make this to be just like flu, where it happens. Mm-hmm. We have cases, but our community does not evolve around it.
Right, and that's obviously I got it for my family and to protect, especially like my grandparents, but too like, to protect the community and move this community forward, because we've all had one heck of a year. And I know you have. Like, I still can't imagine being in your shoes this year, making all the decisions you had to. But let's move our community forward. Let's move this country together. Let's go. So is there anything else you would want to add on the health department or COVID end of things?
I want to say what wonderful leadership we have at the health department. Our director, Mr. Randy Evitz, he had been at the health department just about a year when this started.
And he got it.
And a pandemic hits, and he takes it with grace, with calmness, and with logic to protect our community and to make decisions with all decision makers at the table. He's never done it in a silo. He wants to know what our city thinks, what our county thinks, what our hospitals think. Let's all get together for the better of our community. And he worked very close with emergency management with Sheriff Taylor, and he has been a great leader. I'm fortunate to work underneath him. I've learned a lot from him, and just the poise and what he's shown for our community has been great. And the staff that works underneath him and the people I've been able to work with. But I thank our community for wearing masks. I know in November, December, we peaked with cases. We were the highest in the state, I believe. And then January, we dropped to the lowest in the state. And I give it to our community because they did the right thing at that time. I think for the holidays, people really didn't have big parties.
Oh, no. It was a different year for everything, every holiday, every birthday.
Yes.
I made my husband a shirt like, this is my quarantine 40th birthday. You got to make the best of it.
You adapted, yes.
And it's so weird. Like the kids, even them, my kids are preschool and kindergarten. So first time going to an elementary school, they don't know any different than wearing a mask. Like they just think that's the normal. So they just throw it on.
I think the kids adapted better than the adults.
Oh, absolutely. Absolutely. Well, again, thank you to you and everybody who has put tremendous amounts of work into keeping our community safe. I thank you.
You're welcome.
Yeah. And so, I reached out to you because I think you're an influential woman, and have there been any women in your life that you have looked up to who have inspired you?
Yes. I think growing up, it starts with your mom. You look up to your mom. My mom is a strong woman, and she had a business of her own. She worked in real estate for about 30 years in Pueblo West when it was...
Who's your mom?
Judy Meyer is
Okay.
her name. It was Judy Brustel Meyer. She owned Plinsky Brustel Real Estate,
Okay.
which was right by the library. There was a bank there back when we were growing up in Pueblo West. And her mom worked with her, and my grandma always was working to keep the family together and have dinners for the family, which now my mom does, bringing the family together. And I was also fortunate on my dad's side. I have an aunt who I looked up to. She'd always take my brother to parks during the day when my dad was working, because my parents divorced when I was in about kindergarten, first grade, and my dad moved back to Minnesota where I was born.
Okay.
So I would go to Minnesota in the summers and get to spend time with that side of the family.
Oh, that's cool.
And one aunt would take us to parks and take us to the zoo, and then she'd bring us home and get Twinkies, which always is a special treat.
I do love a good Twinkie.
And then another one of my aunts, I was one of the only girls in Minnesota. It was all boy cousins and my brother. And so we'd, of course, be playing and getting dirty. And there was no clothes for the girl. So she would literally take cloth and sew an outfit for me to go home.
Oh, wow. Oh, wow.
And she would make her own bread, and she was just amazing to feed her family and take care of her boys. And I was the only girl, and they always treated me special, and they were all hard workers. I admired that and had a sense of adventure, too.
Do you think you took that quality of being a hard worker today? Like, do you think they've helped to make you who you are?
Definitely.
What other things qualities do you see that you pulled out of them that you instill today?
Family, putting family first, and investing in your family to provide for your family, whether that's love, a space to gather, food on the table, and organization in the family. So you can support your children. You know, when you're putting forth for your children to go do something, it's to support them and make sure the family can be there for them.
Absolutely. And what is your why?
My why? I think my why, I do things, I can tell you when growing up, I've always done things for the environment. So when I went to college, I majored in environmental studies. And my goal coming out of Boulder at CU was to bring recycling to Pueblo. That was my goal. That was my why back then in my,
I love
my late teens and early 20s. And I went to the East Coast for a while and worked. And I came back to Pueblo, and the health department was hiring a position that was called the environmental coordinator. And the person was to work on waste reduction and to bring recycling. It was like it was created for me.
I love it.
So I've
never seen anybody this excited about recycling, so I love it.
I applied, I got the job, and I coordinated cleanups for household hazardous waste and neighborhood cleanups, and started introducing waste reduction to the community, and then obtained a grant to get recycling into Pueblo. And it was just a grant to put drop-off recycling to prove
and that's gone well. That was just a couple of years ago, right?
Well, it was, I think, actually in the early mid-2000s was the first grant.
Oh, okay.
So from that is what you're talking about.
Oh, okay.
And the grant was a 5-year grant, and there was a drop-off near the Still Mill in Bessemer and a drop-off in Pueblo West, and they did great. They almost overflowed every week before they got picked up, which meant people had to take their recyclables and drive them down there. It proved it did well, but locally, the community of the city didn't pick it up, or the county, as saying, we want to institute this. And so I got frustrated, and I went back to school and got my master's degree. And around that time, West Nile virus happened in the community. And unfortunately, we had our first death due to West Nile virus. And the Pueblo chieftain called the health department, and they had talked to our environmental health, our nursing, and our director. And the next day in the newspaper, it looked like 3 different agencies that they talked to. So myself and a couple other staff members said, this does not look good. We need to help our organization. So we thought of the idea of a public information officer, and we presented it. And I had been in training for communications for the previous 6 years, where I'd been sent to the East Coast in Denver for crisis communication training for the mustard agent that we have at the depot.
Oh, yeah.
And I was representing the health voice in that. And so when the health department said, this is a good idea, we should have a one-point contact for media inquiries and for communications. And then I put my name in and applied, and I received that position. So that's
awesome.
Where I've been for over, I think, 17 years at the health department, is in communications. So during this position, I've watched the city did open a drop-off recycling, which is open year-round. It's called Recycle Works off Stockyard Road. So I can think I planted the seed.
Yep.
And my why is happening. Yeah. People can go every week and recycle, which is
And why is it so
wonderful.
important to recycle?
So
if you don't recycle, this is why you should.
When I look at landfills, I look at our land. We have beautiful land across the world. And we can have it open where people can enjoy it as it is and wildlife can enjoy it as it is. Or we could have a park on it. Or we could have homes on it, or we could fill it with what we don't want anymore and build it into a mound, and then it becomes a landfill. And they're just not that pretty.
No.
And a lot of those items can be reused, and then we don't have to use virgin materials. And it often takes less of our resources to reuse.
Do you think the city will ever adapt like a recycling program like other communities? You know, where it's just part of the trash service?
That was one of my lessons learned, Jenny. That's a great question. So when I was going to school up in Boulder, Boulder has one company supplying the trash service for the whole community. And here in Pueblo, we have multiple companies. And so that's where it was difficult to have all those companies buy in and say, yes, we want to offer that service. So some of them have.
Gotcha.
Up in Boulder, they do an option called pay as you throw. So if I just throw this away each week versus if you threw this whole container away, you're going to pay more and I'm going to pay less. So they're encouraging you a financial incentive to reduce your waste and recycle more.
Well, I challenge you, Sarah Joseph.
To keep with that why.
See what you got, yeah. And I love that your why is the environment, you know, because there's not very many people that have a why for the environment, right? Would you say that's true, or is that just me thinking out loud?
It's not as great. And even the ocean. I love the ocean. I love to scuba dive. And I think my why for the environment, like you said, there's not very many. And I think there's even fewer for the environment of the ocean.
Oh, that's sad. I mean, that's just a whole nother conversation in itself. But, you know, there are people out there doing good work and doing amazing things in that area. So I'm glad to see that. But thank you for your why being, you know, the environment. I think that's super cool and glad to have you in our community.
One thing I was able to do, so I married late in life, I would say in my early 30s. And my husband, he had recently purchased a gravel pit. So he has these huge machines that crush virgin rock. So he's mining rock, which he moves and he helps to build roads. He helps to build homes, and people buy it for landscaping. And
I did not know this.
I've got the why for environment. So I look at his machines and I say, you know, there's a lot of concrete and asphalt just laying around Pueblo. Can't we crush them with your machine? And he looks at me. So now, for free, he takes the concrete and the asphalt, he crushes it, and then we sell it back, and we help build Pueblo.
Oh, I love that. That's super cool.
And
what's the name of the company?
It's so the pit is called Ore Pit,
Okay.
and the website is orepit.com.
Okay.
And you can look at all the material you can buy, and there's also a calculator to help you figure out how much you would need. That's hard for me, the math and looking at the space, but he has it down. And there's different rocks. So we have recycled concrete, recycled asphalt, and then different sizes of rock, and then dirt, of course, and boulders. So orepit.com, and then his company is Colorado Backhoe Service, because he had he still has an excavation company.
Okay.
He's had that for over 20 years, but he was buying rock and using rock to backfill and set the foundations around houses, and and do the septic systems. And he thought, I think I should just buy my own gravel pit. And by recycling and adding the concrete and asphalt, which we're cleaning up, it's not laying around Pueblo as much anymore, he's elongated the lifespan of his gravel pit by over 20 years.
Wow.
Just right now. So
wow, that's awesome.
I hope we keep adding to it and we keep Pueblo clean and we're recycling more. So, you know, I felt really bad leaving the recycling position at the health department, but now
you're doing your
home,
part.
I do my part.
You guys are like two peas in a pod then. Look at you two. I didn't know that about him. That's super cute. So if you could have lunch with somebody, who would it be? Dead or alive?
I would love to have lunch with Eleanor Roosevelt.
Oh, why?
The former First Lady. Oh my goodness. She did so much for equality and rights and treating people with respect and raising them up. And back in middle school, I used to check out books about her, and she had books about how to start a conversation. And she gave a tip of start it with the alphabet for A. Ask them what their favorite apple is.
Oh,
And then
maybe
go to
I should
B.
steal this for this conversation.
Go through the whole alphabet.
Okay. What is your favorite apple?
Oh, I love a Gala apple. What's yours?
I like a Honeycrisp.
They're my second favorite.
Okay. Yeah, the Galas are good too. My kids eat apples like they're going out of style. Like,
Do they put peanut butter with it? Or
my son Parker does. Yeah, it just depends on what I have go. You know, sometimes I slice them up. Sometimes you're on your own. I don't have time.
Exactly.
So, yeah. Eleanor Roosevelt. Interesting.
Yes, did a lot for people, the average people.
And what is your goal out of life?
My goal out of life? Well, I really love health. That's why I worked in public health. And I love learning and I love family. Those are three more of my whys.
Tell me a little more about the health side.
The health side. So when I was in high school, I really wanted to be a doctor. And I realized that there's certain things you can only do so much to help someone, to help your client. And an example is a smoker. And say they've smoked and they've done a lot of damage on their lungs. And you can't do anything more for them. They have to do it. And that really discouraged me. So I changed my mind. And I said, I want to go into prevention. If I can get people to not start smoking in the first place, that would be better in the long run and better for people.
Okay.
And that put me into preventative medicine. And when I was looking into that, I learned about the Centers for Disease Control and Prevention. And they do a lot of preventative medicine at the federal level. And back in high school, I wrote a letter to myself. One of our teachers had us write a letter in psychology. And she said, write the letter and I'll mail it to you in 5 years when you're pretty much out of college.
Oh, what a good teacher.
And I wrote my letter, and around that time, the address that I was going to have it mailed to my parents had moved. So the letter got returned to her 5 years later. And then I think I saw her in the grocery store about 12 years later, and she asked for my address. And we said hi, and then a week or two later, I got the letter in the mail. And in the first paragraph, it said, I hope by now you're working for the Centers for Disease Control and Prevention. And I was working at the local health department, which is the local level of public health. So I did end up back in preventative healthcare, preventive health.
I just got goosebumps. I don't know why, but I just got goosebumps.
It was amazing. When I read it, I was shocked. Like, I knew all along. You know, deep down in your core, you know what you want in your life.
And what was the lesson? Do you think the teacher, who is this teacher, by the way?
Candace Allen, Miss Allen. She was a psychology teacher at Centennial High School.
Oh, what a great teacher to, have you really deep, dive deep in your soul. What is it that you really want? Like, especially before graduation, I'm sure. And then to follow up and still mail it. And then 11 years later, when it doesn't get to you, I mean, what a little hero to.
Yes, she saved it, made sure I would get it.
And then it made you feel like I am doing what I wanted to do.
Yes.
Like my dreams are coming true.
I was
That's
living
a great lesson.
my dreams.
That's a great lesson. So if you're a teacher, especially in high school, to write a letter, I mean, that is just going above and beyond. And I love that as an educator that she did that. That's super cool.
Yes, it was wonderful.
But even super cool that, you know, you got the letter and you're doing what you're supposed to be doing at the same time. But yeah.
So health, preventative health, and public health is all about population health. So your doctor looks after you, but the health department looks after the whole community. We want to make sure you're getting clean air, clean water. You have a grocery store nearby with good food. We want to make sure there's spaces for you to go recreate. And that's what we're working for you to live out your best life.
And what do you do for your health?
For my health.
Like
Interesting year to ask this.
I know.
It's been a tough one this year, but I've recently been regaining, I would say, my health. I enjoy eating healthy. I love water, as you can see.
Oh, me too. I love water.
Yes.
And we have the best water ever. Like
I love it. It's
I don't
fresh
always
out the
need
mountains.
Yeah, absolutely. From Leadville.
So eating healthy, I do like exercise, just walking, being outside in the morning. It can set your day.
Absolutely. I went for a run this morning during the sunrise, and I'm like, just get up, just do it. And sometimes you always say, I want to do it, and then you never do it. But once you do it, it feels amazing.
It does. It does.
You don't regret
getting
it.
out the door. You never do. That's right.
So what do you do to get out? Like, do you have problems with that?
I am a morning person.
Okay.
And I hear the first ding of an alarm, or I'll wake up naturally, but usually it's a little bit of an alarm. I'm up, and then I go.
And do you need coffee to get up?
No.
No. You're just a morning person. You go.
Yeah, I wish I liked coffee. They say it's healthy for you. 1 cup a day.
One cup a day,
without a lot of additives. It's good.
Oh, I know it. It's those additives that get me, but whatever.
But I like tea. I guess
Okay.
I would do that. But exercising, I love riding my bike. Haven't done it in a couple years because
Slacker.
I went to Australia to go scuba dive the Great Barrier Reef, and that was a bucket list.
Yeah.
I did not want to harm any bone in my body the year before I went. So I was in training to get on the barrier reef, and I didn't want to break a bone. And whenever I injure myself, it's on my bicycle. I always fall. And I clip in so I can't get out really quick, and then you're stuck on your bike when you fall.
Interesting. Well, there is a bike club in Pueblo. I think they meet every Thursday at 6 or something. So
Ride downtown. I've done some taco runs with them. Check out all the different places and eat tacos.
I love it. I love it. So, you obviously look amazing, but you feel amazing too when you're healthy and you're taking care of yourself. It's just it's important.
Very true.
If you don't take care of yourself, you can't take care of others. And my why is my family. And so it's hard for me to always put myself first and take care of me, but you have to.
You're so right, Jenny, and I think that's one of my biggest lessons that I'm still learning is growing up. My mother had always said, Sarah, you're burning the candlestick at both ends, because I love to do everything. I love to try and experience everything and being involved as much as I possibly can.
Me too. We have that in common. Yep.
But you wear yourself down. You can only give and be a part of so much. And as you have your children now, you have your husband, I'm in a family now. If we wear ourselves down, we really don't have much more to give to our family. And this past year, bless my family, I've come home worn down, grouchy, and they get the brunt of it.
I'm sure.
And that's not fair. So the lesson is to learn how to have a little downtime for me, a little relaxation, it's more decompression this past year. So I don't carry it out on them.
Oh, I love that. I'm going to tell my husband that the next time I go to TJ Maxx.
Decompression.
Because for me, it's like I don't even need to go shopping, but it's just like I don't talk to you. And I don't take it home. And then I'm going to tell him that. That's my new excuse.
It's for everyone. Yes. It's for the family.
And you said you have a bucket list. Anything else on your bucket list that you're trying to do right now?
So I always see places that I want to see in the world, like Machu Picchu or the pyramids. But my husband and I are working towards taking our RV and visiting all of the national parks.
Yeah,
Yes.
cool.
We want to see all of those. I like the national monuments too. They're amazing. And then I secretly want to sneak in all the presidential libraries.
Oh,
Wouldn't that be cool
that
to
would
go
be
visit those?
super neat.
So I've already getting in my mind. I haven't started it, but I'm going to start spreadsheets with different tabs of all
You're
the
so
things I want to
organized.
see.
She's going to start a spreadsheet. I love it. I love
For my
it.
travels to the national parks in
Okay.
our RV, as long as we have Wi-Fi or some kind of cell service, I'll pull it up. This is where we're going today, and then I want to put in restaurants to eat from, say, Diners and Dash, all the cool places to go eat.
Yeah, do a little blog too after. That'd be
It's a
so
great
awesome.
idea. So that's what we're working towards now.
That is awesome.
So I got to start those spreadsheets.
When you always got to start, you have to have something that you're looking forward to.
You do. And so I went to Australia and got back the first week of January before the pandemic started.
Oh,
I'm surprised I didn't bring back COVID.
right?
Just amazed.
Right?
And it was very cool to be on the Great Barrier Reef. Amazing to be in Sydney, Australia after. But the journey was planning the whole trip.
Yeah.
The year before that, getting all the flights ready, getting the beaches I wanted to go to, making sure I had what I needed. So I've learned it's the journey in life often. The destination can be wonderful, but it's the journey.
Absolutely. And what are 3 words that describe you?
Happy, energetic, and inquisitive.
I see all 3 of those things. I love that. And somebody in your, a woman who's, striving to be in a position like yours, what advice would you give them?
I would say, first of all, follow your heart and your pleasures of what really brings you happiness. Myself, working in a government position, you're not there for the money. You're never there.
You mean you don't make millions of dollars at the health department?
No. I get holidays off.
Oh,
That's the good part.
it's like a teacher too. Like when I used to teach, you're like, I don't do it for the money. I'm still waitressing on the weekend, selling steaks.
Exactly. So I would encourage them for the passion, follow their passion. And I had a passion for public health. And recently I've been meeting students out of the university who come to intern for the health department. And you can see that passion in them. And when they call out, I want to be in public health, there's a uniqueness to even know what that is. What person in their early 20s can say, I know what public health is. I know how it fits in the community and what the need is. And I want to be a part of that. So being a part of that. But then communications, it's learning the techniques and making the relationships. For myself, relationships are key. And me building relationships has helped out with this past year.
Oh, absolutely.
Immensely. Knowing that I could pick up the phone or send an email or send a text and I got a response like that. And it was a true response. People stopped. They engaged with me. So I would say
building the right relationships for that field too.
yes.
When did you feel like this is it? I've conquered my dream. This is what I was meant to do. Was it when you got the letter, or was there another time?
I would say pretty much the year, it would be in 2019, I really settled into public health and thought, you know what? I'm comfortable.
I'm making a difference.
Yeah, I've got a difference. I understand my job. I'm giving back to the community. I've established this role. I helped to create the position at the health department. I also helped to create that I filled that environmental coordinator, and then we grew that. They still had that position, and they had the public information officer. I felt really good, and then the pandemic came in and just
yeah. Besides the pandemic, what other curveball have you experienced within your life that you're like, I don't know if I'm going to get past this, that you learned from?
I've had health issues.
Okay.
And that's what brought me back to Colorado. I was on the East Coast, and I was working a mayoral campaign in Washington, D.C. And
That sounds stressful.
it was really cool. Talk about connections. You can go around D.C. and meet the coolest people when you're campaigning, because mayor is the highest seat. They don't have senators or congressmen for Washington, D.C. because they're a district.
Okay, yeah, that makes sense.
And so it was very fun, very, very fun. But I started having health issues, and I had to return to Colorado. And within a couple months, I was hospitalized. And then
oh my gosh,
you do a lot of reevaluation when you're coming out of the hospital and growing.
Can I ask what happened?
Sure. I was diagnosed with bipolar disorder.
Okay.
So I learned I have a mental disorder, and it made sense for what I'd been going through for the last couple of years. It started coming out while I was abroad in Costa Rica studying in college, and I literally couldn't learn. I don't know if you've ever had an experience where you read the textbook and you can't memorize what you just read.
Oh, all the time. all the time. I'm like, oh, and I have to reread it again.
Yes,
I'm like,
I was going through that, but then when I got back to school at CU, I had really bad depression, and then I would go high as a kite. That's the two poles of the bipolar disorder.
Okay.
So I could stay up for days on end, for 3 to 5 days, and not have sleep.
Oh my gosh.
And then I would crash, and it was hard to get me out of bed and to get to class. And then when I went to the East Coast, it got so bad I was suicidal.
Oh.
And so my mom worked very hard to get me home. And when I got home, we still didn't know what was going on. And so she took me to the doctor and put me on. And the doctor, unfortunately, my doctor wasn't there because he knew me as the bubbly, smiley person. Mm-hmm. And I was very depressed when we went to go to see the doctor. I had no idea.
So I appreciate you sharing this with me.
Thank you.
I do.
I haven't shared it. It's just not something you share because there's stigmas to having health issues with mental health.
Mm-hmm. Mental health is a big key to a balance of life. I was just talking with Dawn with Health Solutions and talking about the mental health, especially after this last year. It's such a key thing that there is a stigma with it, but you have to take care of it.
Yes. So my doctor, when I went to see her a couple months ago, she's just can't believe I made it through this past year without being hospitalized. Huh. She said, I don't know, you're a walking miracle at this point. I don't know how you did it.
So do you still struggle?
I take medication every day, and I exercise every day, and my key is my sleep.
Okay.
So
you have a sleep. Do you have a good mattress? Look at me. It's a sales pitch real quick for Snooze.
I think we need a new one. I was just thinking that yesterday. I was like, oh.
Well, you have to have good sleep because, you spend a third of your life on a mattress.
Exactly.
And so sleep is a key part. So, okay, take me back to, the doctor, and he only knew the bubbly. So how did you?
So that doctor, the new doctor filling in that day, gave me a medication for depression. Mm-hmm. They didn't know what I had. He thought I was depressed. So when you give a bipolar a depressive medication, it shot me up. And it essentially was like I was on cocaine.
Oh my gosh.
So it was a fun week because my brother and I went to visit.
It was a fun week. It was a fun week. I remember that week.
My brother and I went to visit my dad in Arizona. Mm-hmm. And my parents here had bought me a car because I didn't have a car after college and coming home from the East Coast. So I had a brand new car, and we drove down and we did camping. And we went to hot springs, and I remember falling in thin water because I thought I was invincible because I was drugged up. Plus, I did have a mental disorder that was not being helped. And I couldn't sleep. I was high. I was on the high side of bipolar. And we were coming back after about a week in Arizona. And this is the ground rules my brother set for the road trip. Don't go above 90. So on Raton Pass, I was over 100 miles an hour, and I totaled the car.
Oh my gosh.
And it was around midnight, and I felt so bad because my brother was a little bloody and his head was beat up, and
But you guys are both okay.
We were fine. We
Oh,
walked
good.
away, and then I tried to sweet talk the state patrolman out of a ticket because I was still high as a kite. And then they put us in a hotel in Trinidad because it was early in the morning. And I remember my brother, I was so high on energy that he said, do 100 push-ups. So I'd do 100 push-ups, and then he'd say, do 100 sit-ups. And this was at 2 or 3 in the morning, and I just couldn't get rid of the energy. So by the time my grandparents came down, because I don't know how it is. Moms know when something's going on, and my mom couldn't sleep that night, so she unplugged her phone so it wouldn't wake her. So we had to call my grandparents to come get us. And then they took us to my parents, and my mom just took me to the hospital right away. And they put me in the psych ward. And I was still high as a kite, joking about everything, and they slowly brought me down and then found medications that equalized me.
To balance out. Well, I'm glad you figured that out because, I mean, you would have never known.
No, I did not know what was going on. I never heard of it. I
Right.
was working the environmental movement. I was loud and proud, making a difference in that, and working in politics on the East Coast. But when all you can do is lay there and think about the tools to take your life, something's not right.
Absolutely. So what advice do you give somebody who may be experiencing this right now?
Seek help and know there's better days. There's hope out there, and there's better days. You got to keep going.
And what's kept you going?
I have an amazing support system. My mom was there for me. She was gonna make it right again. She knew that wasn't her daughter. And my family that says when you're going through that funk of equalizing again, it's gonna be okay. You just keep going. And friends, and now my husband, that sleep routine is so important. By 8:30, he's in bed. And I will fiddle around. Oh, I got to do this before the day's over. Get ready for it. Sarah, get in bed. Get in bed.
So he helps you making sure that, we got to stick to our schedule because that helps. That balance helps out, and the sleep is part of it.
That's right. It's key. Sleep, low stress, don't do alcohol.
Low stress, and you're in the position that you're in. Oh, my gosh.
That's why my doctor was just amazed. I made it through this past year.
And nothing. And so how often do you deal with it? Or are you just pretty balanced out? You do all the things to take care of your health.
So I was hospitalized in 2008 and then 1998 was my first time. And then I was hired at the health department in 99. And then in 2006, I was hospitalized again. We don't know what triggered that one. I guess it was stress. And maybe I wasn't sleeping right, but I was taking my medication. But sometimes your medication just quits working, and you have to find a new one. So on that one, I had straight hair like you. My hair fell out, and it came back like this.
Really? And I love your curls. I've always adored your curls. I'm like, how do I get cute, natural curls like Miss Sarah?
Just get some medication.
Okay, well, I am on medication, but apparently it's time to switch it up, right?
Yes, I remember it was just falling out, and I was so scared, and then it was coming in, and my beautician said, it's coming in curly.
And you didn't have curly hair before?
No.
Because I've only seen you with curly hair. Do you ever straighten it now?
When I get it cut, I let the beautician straighten it because she does a wonderful job. Quick, she's fast too.
So besides taking care of your health, what else do you do for self-care?
That's tough. I need to do more.
You need to do more.
I think that's one of my lessons. So I eat healthy. I talk to friends. I have great relationships from my girlfriends from kindergarten.
Oh, I love it.
Lifelong friends, and we still get together. We're planning a trip to Greece for my 50th.
Am I invited because I really like Greece?
It was supposed to be the 40th, so 50th. Yeah,
Okay.
you could probably be a great planner and
I've been to Greece. I've been to Athens and Santorini, so I'll help out if you guys need any. So that's fine.
Jenny.
So girl time
Thank
is
you.
so important.
Girl time is important, and those lasting relationships. Like I said, I like relationships and communication and engaging with people and connecting. And I think that's with my family too. I'm close with my mom. I love time with my family. And my husband, we love spending time together too.
Well, that's good because you're married to him.
We're there for life.
But you have moments, I'm sure, right?
Yes.
Yes, but girl time. And I love. So when do you turn 50? Do you mind me asking that?
In just over 5 years. So I'll be 45 in August.
Okay. And you're already planning it.
Well, I meant to be when I was for 40.
Oh,
we were supposed to
gotcha.
go. We talked about this in our 20s. We were supposed to go for
Why
my
don't you
40th.
just go next year?
Well,
YOLO.
we did talk about things happen. You know, you realize things happen in life, and I told him that, and then the pandemic came, and we were So I think we're all still planning. We're not going to wait till we're 50.
Okay.
I think we decided in 2022 or 2023. So if you're ready, we'll all go.
I'm in. I love to travel. That is definitely what fills my cup. And so what else is on your list to do for self-care? Because I'm gonna do a challenge for you. You didn't know you were gonna be challenged today.
I love it.
But yeah, you have several challenges, Miss Sarah. What else do you think would do good for you, for your self-love?
I think meditating would be good.
Have you ever meditated before?
I have tried, and I believe it's a practice.
Because I've tried too, and I was like, okay.
Which means you need to just continue doing it. And
do you have an app?
Of course, I have 3 apps.
Oh, there you go.
But do I use it? No.
All right. So, and you're a morning person. When do you think meditating would be the best for you? At nighttime?
It would probably help calm me down. Maybe that's it. I've been doing it in the morning, and I need to do it at night.
Maybe, yeah, that's my challenge. At 8:30, you need to be in bed, and you need to start your meditation. At least start with 3 times a week. That's my goal for you. Okay. Self-love. Because I hear that's really good. I've only tried a couple times, and I'm like, squirrel. Like, all right, this just isn't for me, but I tried. But maybe if you do like a month of, your set schedule and get that in. Self-love is so important to take care of you in other ways than, just being healthy. But, it's so important.
I read and hear about how it just calms the body, resets.
What's your favorite book?
Favorite book. Oh.
I feel like you've read a lot of books.
I have.
Do you have like a book that's just...
So this is kind of silly, I think, but Oprah's Best Of, she has a book of all of her best. And I love reading about the interviews and all the inspirations and life learns and tips. It was kind of like the best of her magazines put into a book.
Are you going to let me borrow that? Because I feel like now doing this podcast, I don't really have a lot of experience, but it's I need to learn.
Yes, it'd be wonderful. And it's a hard copy, and each page is either one story or 3 in it. So it's nice. So you can just sit down and thumb through it and then put it down and then go back. But I love it. I can get lost in it or get lost in a section because it's sectioned out.
Oh, I love that.
I love Oprah.
Oh, I do too. You in a car. But I mean, she's just so inspiring on so many levels. She's definitely somebody I would love. Can we have a cup of coffee? Tea? What you got? You got 5 minutes for me, Miss Oprah? Let's do this.
I'd go for a hike in her garden. And I would love that in Hawaii.
Oh, she lives in Hawaii too. I'm sure she's got houses all
up on the mountain, and she has gardens.
So pretty. I love Hawaii. So, what else is on your list? Because you have achieved a lot, and you're kind of at the highest point. What else is next for you? What else is on your list that you're like, I want to do that? On a professional level.
On a professional level.
Because you're a goal-getter.
So, as I said, I've filled the public information officer position, and I've been doing it for about over 17 years by myself. I was fortunate.
And you're good at it.
Thank you.
You're so good at it.
The health department knew if I left, they need a backup. So I could go to Australia or go take a trip somewhere. I do enjoy traveling. And they created a backup system. So people who have, excuse me.
You're all right. I make you talk a lot.
People who have other positions, they would part-time train with me.
Okay.
And it helped because when something hits and you need more help, you have the subject matters who also have communication training. And then throughout the pandemic, we now have a web person who I have full-time, and it was part-time going in. And now we also hired a communication specialist to work with me. So I am a supervisor of those 2 people.
Okay.
So now I get to build a communications team.
That's awesome.
and really set out vision for the communication for public health and for Pueblo, which is wonderful. When you're working on it on your own, it's a little hard to step back and see the vision.
Because you're working in it instead of on it.
Yes, so now I get to do that, and I've actually been challenged to do that.
Oh, that's
So
awesome.
That's my next.
That's and you're doing it, so congratulations to you. Well, you are just an amazing human, always just sunshine, and you do so much for our community. I love you, and I'm grateful, and I have you on text message, so I know I can communicate, and like you're a great communicator, for many, many years. Yeah.
Well, it comes down to the big C. I know that communication
it's
in
huge.
our family. So when I married my husband, I was great to get 3 kids, 3 teens.
Oh my gosh.
And things go wrong in families. And I found the common thread, the big C. It was always communication. It came down to, I thought you said that. You didn't tell me this. Why didn't I know that? The big C. And it was for my husband and I and for the kids. And it still is the same thing.
So that's your number one advice in life, in families, in your work.
The big
Communication is key.
Yes.
I agree. My husband and I say that is success to our marriage. Like when we don't communicate is when things go wrong. But if we're communicating, we're always on the same page.
Yes.
And
Smooth.
do you have a song that just kind of describes you?
Hall & Oates, Sarah Smiles.
Well, that makes sense. I love it. Yep. Okay. That describes you.
But I like Prince songs too. He was
Okay.
the first concert I went to back in the 80s, and he pointed at me and threw a tambourine, and I caught it.
You still have it?
My purple tambourine.
I love it. Were you so sad when he passed?
Oh my goodness.
Did you go to Minnesota, go
I
see his
wish
house?
I need
Did
to
you do all
go to
the
Chaska
things?
and go see. That's on the bucket list.
That's on the bucket
to
list.
go see my family that live near where he is. So I want to go do that. I love seeing Prince, but that day we bought a new Jeep. My husband's into Jeeping, and
I love Jeeping.
so it's a black Jeep, and I named it Prince.
Oh my goodness. Did you hear that? You're cute.
Little Prince, I call it, because he
Not
was so
only is she
petite.
pretty and smart, but she's super cute too. Oh,
Little Prince, our Jeep. So
That's cute.
it's funny. Environment was my heart. So I was a walker of the mountains, and I used to do the 14ers and walk them all. And now if I want to walk the 14er, I got to get out of the Jeep and walk while he goes over all the rocks.
I love it. How many 14ers have you done?
I think I've done less than 12.
Okay.
I think.
I want to do 14 14ers. And
a
I've only done
good
one,
goal.
so apparently I should get on that because
you-
I'm not getting any younger.
You hit those collegiate peaks, or you hit Lincoln Democrat and just go up the saddle.
Oh,
You get up one.
I feel
and
like
then you
that's
just do
cheating.
that.
That's totally cheating.
It's fun.
Oh, but I'm going to steal it because I can knock 4 out. Did you say?
And they're close. Yeah.
Okay.
You can just do
will you,
2 or
will you
3.
just text me that? I'm going to put
Yeah.
that on my summer bucket list.
I can put it up. Yeah.
Okay.
And I really like Shivano because it's really sandy. So when you hike up and it's hard, but when you come down, you kind of jump and then you slide on the sand.
Oh,
and
that's
jump,
cool.
slide on the sand.
I love it.
Long's Peak is long.
Sounds real long. I did Albert. That was the biggest.
Yeah.
And
Up high, that's a good one to
is it? I only made it because I thought my husband was going to propose on the top, and then he didn't, and then I was pissed the whole way down because it's I wanted to quit 5 times, but I thought you were going to propose at the top, so I kept going.
Oh, that's a good one.
Well, what does the word influential mean to you, Miss Sarah Joseph?
Influential is to make an impact on someone or many people. And influential can be positive, it can be negative, but it often is an impact where people will model their behaviors after you or model their actions.
Well, Miss Sarah, I think you have made an impact on so many lives, especially our community. We are so blessed to have you. You're impactful in so many ways, and I'm so blessed just to have had this conversation with you, and then I get to highlight you as an influential woman. It means a lot you being here, so thank you.
Thank you, Jenny, and thank you for doing this for Pueblo.
Oh, yeah.
For the women.
For the women. I love it. And is there anything else you want to add?
hope everybody enjoys their summer.
And recycles.
Recycles.
And vaccination.
Yes, vaccination, and make time for yourself. So you have time for others.
Yep. And if you want to start meditating, start with it small. 3 days a week.
3 days a week.
And I'm going to follow up with you, see how it's going.
I appreciate it.
All right. Well, thank you, everybody, for tuning in. And that's a wrap on Influential Women.